You drink coffee every single morning, maybe 2 cups, maybe 3, and you've been doing it for years. But here's what nobody tells you. Inside your kidneys, something is happening every single time you take that sip. Something that, over 10 years, can either be quietly protecting you or slowly setting you up for a crisis. I'm Dr. Lina, a urologist, and in the next 12 minutes, I'm going to show you exactly what a decade of daily coffee does to your kidneys: the good, the genuinely dangerous, and the specific habits that determine which side you land on. Stay until the end, because the mistake most coffee drinkers make, even the healthy ones, is one I see wreck kidneys every single year in my clinic. Before we talk about coffee, you need to understand one thing. Your kidneys are the most underestimated organs in your body. Most people think the heart or the brain is running the show. But your kidneys? They filter your entire blood supply, every drop, roughly 40 times per day. That's about 200 liters of blood processed every 24 hours. They regulate your blood pressure. They control your electrolytes. They decide what stays in your body and what gets flushed out. And critically, they activate vitamin D, without which your bones would dissolve. Now here's the terrifying part. You can lose up to 70% of your kidney function before you feel a single symptom. No pain, no warning, just silent, progressive damage. That's why what you consume every single day, including your morning coffee, matters enormously over a 10-year window. So let's get into it. The second coffee enters your bloodstream, your kidneys notice. Here's the sequence. Caffeine, the main active compound, is a methylxanthine. It blocks adenosine receptors in your brain, which is why you feel alert, but it also acts as a mild diuretic. It tells your kidneys to increase urine output by reducing the reabsorption of sodium and water in the renal tubules. In plain language, coffee makes your kidneys push more fluid out of your body. Now, a lot of people hear diuretic and panic. They think they're getting dehydrated every time they drink coffee. But here's what the research actually shows, and this surprises most of my patients. In habitual coffee drinkers, the diuretic effect is minimal. Your kidneys adapt. Over time, the net fluid loss from a cup of coffee is roughly equivalent to the water you just drank in that coffee. So if you're a regular coffee drinker, you're not chronically dehydrating your kidneys. But, and this is a big but, if you're new to coffee, drinking it during intense heat or already starting the day slightly dehydrated, that diuretic push does matter. Coffee also triggers a temporary rise in blood pressure. Within 30 minutes, systolic blood pressure can jump 5 to 10 millimeters of mercury. For healthy kidneys, this isn't catastrophic, but sustained elevated pressure, day after day, year after year, that's one of the top 2 causes of chronic kidney disease. We'll come back to that. Now let's zoom out. What does a decade of daily coffee actually do? Here's where it gets interesting, because the data is more nuanced than most health headlines want you to believe. The protective side. Multiple large-scale studies, including data from over 200,000 participants tracked across 8 to 12 years, have found that moderate coffee consumption, meaning 2 to 3 cups per day, is associated with a lower risk of kidney stones. Why? Coffee increases urinary citrate excretion. Citrate is a natural inhibitor of calcium oxalate crystal formation, the most common type of kidney stone. More citrate in your urine means stones have a harder time forming. Additionally, coffee contains polyphenols, specifically chlorogenic acids, which have antioxidant and anti-inflammatory effects. Chronic low-grade inflammation is a driver of kidney fibrosis, the scarring process that permanently reduces kidney function. Polyphenols appear to slow this process in multiple organ systems, including the kidneys. There's also emerging data showing that regular coffee drinkers have a modestly lower risk of developing type 2 diabetes, and diabetes is the single leading cause of kidney disease worldwide. So indirectly, coffee may be protecting your kidneys through blood sugar regulation. Now, before you use this as permission to drink 6 cups a day, Let me tell you what happens on the other side of that curve. The harm side. The protective effects largely disappear and reverse above 4 cups per day for most adults. Here's what chronic overconsumption does over 10 years. First, blood pressure. Habitual high-dose caffeine keeps your sympathetic nervous system chronically activated. Elevated catecholamines. Sustained vascular resistance. Over a decade, this contributes to hypertensive nephropathy, kidney damage driven by chronically high blood pressure. I see this pattern regularly in patients in their 40s who don't understand why their kidney function is declining. Second, oxalate loading. Coffee, particularly in large amounts, contains oxalates. Oxalates bind calcium in your gut, but the excess goes to your kidneys. Heavy daily coffee consumption, especially without adequate hydration, significantly elevates urinary oxalate and increases kidney stone risk. Third, and this is the one most people completely miss, additives. The coffee itself, consumed black, is very different from what most people actually drink. If you're adding 2 tablespoons of flavored creamer, 20 grams of sugar, and maybe a sweetened syrup twice a day, every day for 10 years, you are not a coffee drinker. You are a daily sugar consumer with a coffee delivery mechanism, and that metabolic load is absolutely hammering your kidneys over a decade. Here's what I need you to hear clearly. For healthy adults with normal kidney function, moderate coffee consumption is unlikely to cause significant harm and may genuinely offer some protection. But the word healthy is doing a lot of work in that sentence. Let me tell you who is silently at risk and doesn't know it. Group 1. People with undiagnosed hypertension. A third of adults with high blood pressure don't know they have it. If that's you, your kidneys are already under pressure, literally. Adding daily caffeine-induced blood pressure spikes on top of that is fuel on a fire you don't know is burning. Group 2. People with 1 kidney or reduced kidney mass. Whether from donation, surgery, or a congenital condition, if you have reduced nephron mass, your remaining kidney tissue is working harder. Diuretic effects and blood pressure changes hit differently when you have less reserve capacity. Group 3. Chronic dehydrators. You know who you are. You wake up, drink coffee before any water, drink more coffee mid-morning, maybe have a soda at lunch, and realize at 4 p.m. you haven't had a full glass of water all day. This pattern over years causes chronic mild dehydration. Your urine is consistently concentrated, and concentrated urine is a breeding ground for kidney stones and urinary tract infections. Group 4. People with early-stage CKD. If you've already been told your creatinine is elevated or your GFR is trending down, high caffeine intake is not your friend. The kidney's reduced ability to maintain homeostasis means the blood pressure swings and fluid shifts from coffee are harder to compensate for. If you are in any of these groups and you're drinking 3+ cups of coffee per day, this is the moment to have a real conversation with your doctor. Not in a panic, but with information. Here's the good news. You almost certainly do not need to give up coffee. What you need is a strategy. And I'm going to give you mine, what I actually tell my patients. Rule 1. Water first, every single morning. Before coffee touches your lips, drink 500 milliliters of water. Every day, no exceptions. This single habit breaks the chronic morning dehydration cycle, dilutes your urine, and reduces stone-forming mineral concentrations. Over 10 years, this is probably the single highest impact kidney protection habit you can build. Rule 2. Know your number. For most healthy adults, 2 to 3 cups of black coffee per day sits in the protective zone. Beyond 4 cups, the risk curve starts climbing. This isn't arbitrary. It's where the data consistently draws the line. Rule 3. Audit what's in your cup. If your coffee comes with cream, sugar, syrups, or artificial sweeteners, your kidneys don't care about the coffee anymore. They're managing a metabolic event. Reduce the additives. If you need flavor, try cinnamon, unsweetened oat milk, or a small amount of quality cream. Your kidneys will notice the difference over time. Rule 4. Check your blood pressure annually. This sounds unrelated, but it is the single most important kidney protective action you can take. If your blood pressure is consistently above 130/80, your kidneys are under sustained mechanical stress. Know your numbers. Act on them. Rule 5. If you have a history of kidney stones, track your oxalate load. Coffee is a moderate oxalate source. If you've had a calcium oxalate stone, the most common type, you need to be thoughtful about total dietary oxalate, keep urine volume high, and consider whether your coffee volume is contributing to recurrence. Patients ask me all the time, "Dr. Lina, should I switch to decaf to protect my kidneys?" Here's my honest answer. Decaf is not automatically safer from a kidney perspective. The diuretic effect is lower, yes, but decaf still contains oxalates, still has acidity that can affect bladder health, and the additives problem is identical. If you're drinking decaf with 3 pumps of vanilla syrup, you have not made a healthy choice. You've made a psychological one. The most kidney-friendly version of coffee is 2 cups, black or minimally modified, after you've hydrated, spread across the morning, and not used as a substitute for actual water intake throughout the day. That's it. That's the protocol. So, what happens to your kidneys when you drink coffee every day for 10 years? If you drink it smart, 2 to 3 cups, hydration maintained, blood pressure monitored, the evidence says your kidneys are likely fine, possibly better than fine. If you drink it carelessly, high volume, chronically dehydrated, unmanaged blood pressure, loaded with sugar, you are running a slow-motion experiment on organs you can't feel failing until it's very late. The difference between those two outcomes? Mostly awareness. And now you have it. If this video helped you, hit like. It genuinely helps this channel reach people who need this information. Subscribe if you want more evidence-based content from a practicing urologist. And drop in the comments, how many cups a day are you actually drinking? I read every one. I'll see you in the next one.